Good evening.
Good evening.
Can you all hear me well?
Yes.
Wonderful. Let us begin. Woo. So, this poem is entitled White Coats. They say if you are ill, to call on God. So I called. Better yet, I screamed. As a matter of fact, I ran to see God in a shroud of fear and body aches. I came, seeking support, understanding, and healing from the Almighty. His white coat, a symbol of refuge and purity. Funny how we associate white with all things good. I sit on the examination table, vulnerable, openly allowing him to dissect my body and fix what had been broken. I tell him where it hurts. My words pass through him and do not take root. My concerns do not resonate. I realize he does not speak my same language, and we became lost in translation. While waiting in uncertainty, my eyes scroll up to his face. There was no light beaming from him. His touch was cold. I did not see my image mirrored back at me. What I see is unfamiliar. What I hear sounds nothing like home and feels nothing like love. This was not God. I was not his child. I was seeking refuge in what felt like a foreign land that knew nothing of who I was or where I came from, and frankly did not care. I was just another obligatory appointment. Simply a brown face with a name he would soon forget, whose pain was nothing more than a prescription write-off. This was not salvation. Felt more like condemnation, wrapped in microaggressions, from someone who could not imagine walking a day in my shoes, yet blames me for not being able to pull myself up by my own bootstraps, not knowing that every day I walk barefoot through a concrete jungle laced with mines. I barreled through trenches just to make it here today. How dare he judge my ability to survive? There was no connection between us. How silly of me to have placed him on such a holy pedestal. His white coat, now symbolizing the distance between us. His emotions, like that coat, were blank and sterile. There was no color, no vibrancy, no life in his tongue. Only power and prejudice sewn into the letters MD on a pocket patch. But the thread was beginning to unravel. This was not God. Perhaps this is why my grandmother never enjoyed going to the doctor. There's a reason why they call it a practice, baby girl. Some of them are just practicing. Well, my life is not for practice. I am not a mindless process. I am black, I am woman, I am human. I refuse to be dwindled down to a statistic on an intake form. I left off the examination table, put my clothes back on, and covered my pain, vowing never to be so exposed again to someone so undeserving, vowing not to return until my image was reflected back in the face of my healer and we finally spoke the same language, where my words would fall on good soil and I could be vulnerable enough to allow someone to help me fix my pain. Good evening, everyone. As was just mentioned, my name is Bethanee Epifani, and the poem that I wrote and recited for you is reflective of the experiences and the emotions I felt when seeing a doctor. One doctor in particular was a white woman, the other was an Asian male. Both did their job accordingly, but neither one truly seeing me, or listening to me, or understanding me. And I know that I'm not alone in my experiences. It is the experiences of people of color and those in the LGBTQ community that continuously go overlooked. And it is one reason why many do not seek professional care at all. It is the anger and the fear that comes as a result of being mistreated and ignored. In the poem, I talk about how my grandmother was suspicious of doctors. Her level of suspicion was passed down to my mom. My mom has a sister, Irma. My Aunt Irma is mentally and physically disabled, and my mom serves as her guardian. And one day, my mom had scheduled Irma for a mammogram. And while at the doctor's office, the doctor informed my mom that he felt a lump in Irma's breast and that he was going to schedule her for surgery right away. Keep in mind, he didn't do a complete exam, he didn't do an x-ray, none of that. He only did it based off of what he felt. My mother informed the doctor that Irma would not undergo any type of surgery without a proper exam and without a second opinion. She rejected his suggestion, something that many don't do. In the poem, I use the word God to describe doctors, and the reason I do that is because in my experience, that's how some doctors view themselves to be. And that's how many of their patients treat them, like God. They are all-knowing, therefore what they say goes. To question or oppose someone in the medical field is to go against the social order. And my mom's opposition went against the social order. My mom made God mad. How dare she question him? Which is exactly what he told her. He roared his anger at my mom. Now, is that how a servant of the community should act? After that experience, my mom, of course, said she would not return. And she took my Aunt Irma to the Women's Breast Diagnostic Center, where they discovered that there was no lump, in fact, only fatty tissue. The previous doctor was wrong. And my mom was bold enough to look beyond his white coat to see a man that cared nothing for her sister, that cared nothing about providing proper and well-informed treatment. This was someone that was more interested in satisfying his own ego than caring for his patient. My mother's level of suspicion towards doctors and those in the medical field was passed down to me. Lucky me. But that's how these things work. Horror stories are passed down from one generation to the next, which results in many people of color and those in the LGBTQ community from seeking medical attention. But these horror stories are not just coming from those in our community, they're coming from celebrities as well. Let's take the amazing tennis champion Serena Williams. The devastating rate of Black maternal mortality received even more attention after Serena Williams gave birth to her daughter. After giving birth, Serena informed her medical team that she was experiencing pain. She feared having a blood clot, and she wanted a CT scan and an IV blood thinner. Her medical team ignored her concerns, assuring her that she was fine, and one of the nurses from her medical team told Serena that the medication she was taking was making her confused and delusional. Delusional. Imagine going to the doctor, expressing your pain, and them telling you that it's all in your mind, that it's delusional. How enraging that is. Fortunately, they listened to her. Why wouldn't they? She's Serena Williams. And they discovered that there was, in fact, a blood clot along with other medical issues. But had Serena Williams not been who she is, had she not so strongly advocated for herself, who knows if she would be alive today, because so many Black mothers died due to childbirth complications. In response to this growing concern, OBGYN Neil Shaw says, the common thread is that when Black women express concerns about their symptoms, clinicians were more delayed and seemed to believe them less. It's forced me to think more deeply about my own approach. There is a very fine line between clinical intuition and unconscious bias. And people in the LGBTQ community share horror stories as well. They share stories of discrimination, verbal abuse. Some don't even get medical attention at all. Aaron Armstrong, who identifies as transgender, said, I don't know what the next doctor is going to know, or whether they'll even treat me with respect. So I put off finding a doctor as long as I can. It's not the best way to take care of your physical health. These shared stories of neglect and disrespect and discrimination and death from people of color and those in the LGBTQ community should serve as a catalyst for this initiative. We understand that this neglect and this ignorance does not reflect everyone in the industry. but it reflects enough to the point that it is a national concern. It reflects the fact that people still receive unequal treatment depending on what they look like. It's been going on for far too long. It's not simply poor bedside manner. It's immoral. One way to address this problem is to start by taking steps to relieve the healthcare industry of its racial bias and its ignorance, which serves as a foundation for their poor treatment of people from different backgrounds. And one way of doing this is by making serious efforts to diversify the industry. Diversifying the industry provides knowledge that can lead to quality service. A physician from the New York Presbyterian Hospital said, "It can help us move toward a system in which the lived experience of minority groups is better understood and validated, and the barriers they face more readily identified and addressed." Lisa Cooper, the Bloomberg Distinguished Professor in Health Equity at Johns Hopkins, said, "It's about giving doctors the skills, knowledge, and attitudes to understand the many societal and historical factors that affect health, instead of thinking of health as something that is just the result of individual choices and behaviors." Diversifying healthcare means to bring in people with new, relevant, life-saving information to an industry that has been historically sexist, that has been historically racist. It means that those in this industry would finally reflect the communities that they serve and bring a voice to those who have been silenced. Because we have to ask the question, would we hear these stories constantly if those in the industry reflected in terms of racially and gender-wise, reflected the communities that they serve? Here's a quote. "I was skeptical about coming in here, but when I saw you, I thought, maybe this won't be so bad." These were the words of a Black TSA worker who was dealing with stress and anxiety because he didn't know how he was going to support his family during the government shutdown. He sought mental and emotional support, something that is slowly becoming more acceptable in the Black community. And this Black TSA worker spoke these words to my relative, who serves as a mental health clinician in a very well-known hospital clinic in Los Angeles. My relative is the only Black male mental health clinician where he works. And he gets these responses often from Black patients who feel more at ease when they see him. This TSA worker wasn't even a patient of his. He just happened to see my relative walking through the halls. And he gets these responses often, especially from young Black boys who really long to be his patient. My relative told me, he said, "Unfortunately, I'm not always available to take on more clients, more patients. But just imagine if there were 2 or 3 more Black mental health clinicians." His department is 75% women. Most of them are white. My relative told me that there's a benefit in seeing yourself in your healthcare practitioner. It allows you to connect better. It's about connection. And those in this industry need to be reminded of that. It's about fostering a relationship that leads to someone else's healing. And at the end of the day, that's what this is all about. Healing. No matter what role you play in this industry, whether you are an executive or a doctor or a healthcare marketer, the focus should be on healing. Healthcare marketers have a role to play. As marketers, you create, communicate, and deliver health information and interventions to protect and promote the health of diverse populations. You serve as a bridge between the patient and the service you are trying to promote. How do you connect or communicate to a market that you know nothing about? How do you connect and communicate effectively when that market is not even reflected in your own industry? You need insight that produces effective strategies. And I happen to know a lot about insight. Last month, I spoke at Tulane University. I spoke about being a Black professional woman. And I told the students that I had an advantage because I was black. As a black person, you are forced to operate in different worlds. You are forced to operate within your own world, within your own community, and you are forced to operate outside of your world, outside of your community, and into the mainstream. There is no other option. However, operating in different worlds forces you to learn about a community, about someone that is different than you. It provides insight. It is this insight and this knowledge that allows you to connect better. And I get asked to speak at different events because of my ability to connect with different audiences. And I realized that my colleagues didn't have this advantage. When I first started out in the speaking field, the primary speakers were white and male. That was their world. And they couldn't speak outside of audiences that looked differently from them. Their world was the dominant world. They didn't have to go out and learn about anyone other than themselves. But that's changing because the world is changing. We live in a diverse nation that is requiring you to acknowledge the multiple communities that make up our country. Being culturally ignorant or ignorant about sexual orientation or gender will no longer be tolerated. You have to learn how to foster relationships with people that are different than you, and why wouldn't you want to? This industry is about fostering relationships. It's about fostering trust and understanding. Why did you decide to work in this industry if you were not going to put the people first? It's about what your intention is. What is your intention? If your intentions are for personal gain, then the progress that we so desperately need will be at a halt. If your intentions are selfish, then you're in the wrong industry, baby. Because this industry is about being of service to the people. It is about fostering life regardless of what that life looks like. This is the intention. The health of humanity. And you cannot forget your intention because it serves as the motivation behind your actions. And the motivations behind your actions, especially in healthcare, should be love. Do you love what you do? Do you love the people that you serve? Do you love fostering life? But love is honest. Let's be honest about the sexism and the racism and the prejudice that we all have. Let's enter into these uncomfortable conversations that we often try to avoid. Let's be honest about the fact that diversity is vital to progression and improvement. Love is also consistent. Let us be consistent with the care we give across the board. A person is a human being no matter what they look like. Let's be consistent with how we care for humanity. Love is inclusive. Let's be sure to include the voices of all those that we serve because their voice matters. Their insight, their experience matters. Their physical presence in this industry, it matters. While online, I came across an oath that a healthcare marketer wrote. This healthcare marketer felt as though all marketers should have a code of ethics that they abide by, similar to the Hippocratic Oath. However, when I read it, I was like, you know what? I feel like this is something that everyone in the industry can abide by. As I read pieces of it, I want you to reflect on the words. Let it serve as a foundation for the work that you do. It reads, I will remember that I do not sell a product or a service, but that I help a human being whose needs may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the society I serve.